All right, so what are some of the causes? Well, genetics are a cause, and I'll tell you what, if genetics is your thing, papers on metabolic associated fatty liver cover all the different genes. There's probably around a dozen of them, maybe 20 different genes associated with metabolic associated fatty liver. So if genes are your thing, genetics is a component in some cases. Gut microbiota, I put that second because that's a big one. Adipose tissue dysfunction, fat inflamed toxic cells, less adiponectin, more leptin, more chemokines and adipokines. Hepatic lipid accumulation, we just talked about. It's either making too much and it can't get rid of it, or all the fat is coming out from the rest of the body and it's going to the liver. Insulin resistance can cause that. Hepatic mitochondrial adaptation, more mitochondria, more oxidative stress, more beta oxidation, more oxidative stress, more incomplete beta oxidation, peroxisomes, everything we just saw. Intrahepatic mechanisms, that's where you get the Kupffer cells, the macrophages, the cytokines, and that's when it starts to turn into inflammation and fibrosis. And then contributors to this, so this is one to really pay attention to. Number one, reducing methionine and or choline in the diet leads to fatty liver. Now, I'm not going to get into all this too terribly much, but that I'm aware of. Vitamin E is the most under-consumed micronutrient by industrialized countries, at least here in America. Choline, I believe, is second, followed up by magnesium, which everybody talks about. But there's more to the choline story. But if you reduce choline, then even if you're eating the AI of it, the adequate intake, that will lead to fatty liver.